Hi, my name's Molly.
And my name's Isis.
Are you a medical student?
We are.
Yes, we
Your
are.
name's Isis?
It is.
That's like an Egyptian goddess.
It is.
Yes. And she's Annie down there.
She is.
Oh, that's good names. Right, so how do you think your day's gone so far on Restart a Heart?
It's gone great, hasn't it? I think we've got like over 150 people. Like we've taught CPR to. Yeah, it's great.
My name is Harry. I'm a medical student from Sheffield University. And we're here today teaching CPR as part of Restart a Heart Day in Sheffield Train Station.
So it's a valuable thing to learn, this. This is a dummy, this, is it?
Yes.
Yes.
This is what we call resusci, and this is one of our...
Resusci.
Yes.
Met her in Filey years ago.
So this is what we use to train CPR. She looks a little bit scary because she hasn't got any arms or legs, but we are teaching people today how to do CPR. Do you know how to do CPR yourself?
No, I was hoping you might enlighten me.
What we teach people when they find somebody who has passed out, is unconscious, is use an acronym called Doctors ABC, so DRS ABC.
Doctor spelt ABC. I thought it spelt DOC or DR. It's spelt AB. Oh, you've enlightened me already. Could you describe what Resusci Annie looks like? Yes.
I don't know.
So it's just like
She's no
a
legs.
torso, just the hips up,
No
No
arms.
arms, yeah.
nice head, she's got a bit of hair, and
Okay.
it's just a tool for teaching people how to do chest compressions
I see.
and checking the airways.
Checking the airways.
The D for doctors is danger. So first you need to check for any danger. If the patient has been drowned or electrocuted or anything like that, you definitely don't want to get yourself in that situation. And the next thing is R for response. So you need to check if the person is awake at all. They might have just...
If they say do they go is that how you know they're awake?
Yeah, well that's
I see.
one of the ways. So we shake their shoulders, we shout to them, hello, can you hear me? Can you open your eyes?
I'll just try that. Hello, can you hear me? Can you open your ears?
That'll do. And then assuming that we've got no response from them, we get to the S of doctors, which is shout for help or call 999. Because if we've got somebody who's unconscious, then we need to get some help to them immediately.
I see, yes.
Yeah.
Yes.
The next thing we do is we move on to the ABC part of the acronym, which
Right.
is airway. So what we'll do is we'll put 2 fingers on their forehead.
Two fingers? Putting 2 fingers up, it's rude to do that.
It is indeed, yeah.
Yeah, right.
But you know,
So-
needs must.
Okay, so 2 fingers on. Excuse me, Resusci Annie. I'm going to put me. I'm going to have to touch your forehead. Is that all right?
That's it.
Oh, she's quiet, isn't she?
Yeah. So 2 fingers on her forehead, and then 2 fingers on her chin, and then you need to tilt her head back. And
Oops.
as you do that, try and have a look in the mouth and see if there's anything inside it.
If she's choked on a boiled sweet or something, you mean?
Yeah,
could have-
she could have choked on a boiled sweet or something.
Well, if there's a boiled sweet in there, can I have it?
yeah,
Because it could be Army Navy mixture. That's one of my favourites.
Lovely.
Yes.
Yeah, get it out. That's perfect.
Okay. Oops, I don't pull her head off. It's a bit loose.
yeah.
This. Oops. Sorry, Annie. I'm a bit heavy-handed, I know.
Once we've checked their airway to see that there's nothing in it, what we need to do next is check their breathing. So I'll need you to keep her head tilted back like you've got right now.
Oh, it hurts your knees being down here, doesn't it?
It does indeed,
Oh,
yeah,
I'm
I
wearing
know.
knee pads for this.
And the next thing you need to do is pop your ear over their mouth.
My ear over the mouth.
That's it, and look down their chest.
Not
for
my mouth
10
over the ear.
seconds.
Not my mouth over the ear. No,
No,
other way around.
No, that's gonna.
Okay, 10 seconds, all right.
10
yeah.
seconds, that's it.
Fine.
And if you can't see any breathing in that time, then you need to move on to the C of the ABC approach, which is compressions.
Compressions.
Yes,
Right.
exactly. Because if we've got somebody who is unconscious and they're not breathing, then that probably means that either their heart has already stopped or it's going to stop soon, which means we need to get the blood pumping around their body.
See.
So
yes.
we need to do chest compressions.
Yes. When you check the airway, if there's an obstacle in there, you remove it.
So we actually say no if there's
it's a boiled
something.
sweet?
No, don't
Try-
go anywhere near the
I
mouth.
can't have it then.
No, you can't.
No, oh,
Unless
all
it's
right.
really obvious and like
Yes.
completely hanging out.
Don't
worry.
yeah, because the danger
see.
is that you'll push it back even further,
I see.
and you don't want to do that.
So I'm afraid you're going to have to get a little bit up close and personal with resusci now.
All right.
If you interlace your fingers.
Interlace my fingers, yeah.
Yes, that's it.
That's right.
Exactly.
Yes.
And then pop your hand over the centre of her chest, with the heel of your hand pushing over her breastbone.
Excuse me, young lady, I'm going to have to touch above you. That's it.
And then we need to push really hard down into her chest, really fast.
I won't break her ribs, will I?
Or you might do, but that shows that you're doing it well.
Does it?
Yes, it does.
Okay, here we go then.
That's it. Lovely.
Is
And
that
we need
right? Am I rocking backwards and forwards in position properly?
rocking backwards and forwards a little bit is okay.
That's
Try not
okay.
to do too much because it means that you might not be squeezing hard enough.
I see.
It's
Yeah.
mainly hard, down really hard and fast.
Down
so
hard
twice the
and
second,
fast.
or to the tune of Staying Alive.
Really?
Indeed. Or Nelly the Elephant or Baby Shark.
I'll try Nelly. I don't remember Staying Alive. It was by Bee Gees.
Wasn't
They
Bee,
wore
yeah.
very tight trousers. I remember that. So I'll try Nelly the Elephant. Here we go then. Nelly the Elephant sank the punt and said goodbye to the surface.
Perfect. That's it. And we just need to carry on going until an ambulance arrives.
I can hear one now.
Yeah?
Watch, that's an ice cream van. Sorry. Are you okay there, Annie? Can you hear me, Annie? She's not responding very well at the moment.
No, she's not. She
No.
probably won't. And now the next thing you might be able to do is go and get a defibrillator if you've got somebody around you.
Get a what, sorry?
A defibrillator.
A defibrillator.
Yes, indeed. Or an
Is that
AED.
like the Terminator? Is
Little
it like-
bit.
There is one sighted at the station, I believe.
There
is
is
that
indeed.
correct?
Yep. But if there's one far away, then you wouldn't want to run away and do it. You'd
Yeah.
want somebody else to go and get it. Once you've got
That's
one
the
of those,
ambulance. It's coming, look.
that is indeed the ambulance.
It's here. It's bang.
Almost
It's...
here.
There we go. Yes. So Harry, what? So defibrillation. Oh, these things look a bit serious. Is it the electric these?
They are indeed. So a defibrillator uses a large electric shock across a patient's chest.
A large electric shock.
It does
I'm
indeed.
trying to save her, not.
I know. A patient's heart works by using electricity to control it, and
Right.
sometimes the rhythm of the different parts of the heart can get out of sync, and what we need is a big electric shock to make everything stop so it can start again normally. That's what a defibrillator does for you.
I see.
So we'll get our defibrillator out.
Yes.
As somebody continues doing the chest compressions,
I'll keep going.
we'll open up this defibrillator here.
Staying alive. Staying alive. Oh, 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 oh. Staying alive. You can
That's
tell
the
by
one.
my walk. I'm a woman's man. No time to talk.
We've had some really positive feedback. Everyone seems to have found it really helpful and they feel a lot more confident in knowing what to do when they approach somebody that's collapsed.
I think
So while you've been doing those compressions, I've got this defibrillator out of the box. It's just a little plastic box with some buttons on it. I've plugged the pads in and I've stuck the pads to the patient's chest where it shows me on the image.
Oh yes.
Now what we'll do is I'll ask you to stop CPR as I turn the defibrillator on.
Will I get a shock?
You won't get a shock,
Right.
don't worry. When the defibrillator tells you, it will turn on, it will be very loud and it will tell you analysing rhythm, don't touch the patient. So that's when take your hands off of the patient so that the machine can see what the patient's heart is doing on its own.
I see.
Then it'll either tell you shock advised or shock not advised. Now if it doesn't think you can shock the heart, then you'll just need to carry straight on with CPR again. If you think that a shock is advised, it'll start making a big loud noise, might be really high pitched, an alarm might go off.
What, like the Bee Gees singing?
Yeah,
Staying
indeed.
alive?
Yeah.
I see, because that was very high pitched. That.
Yeah,
was.
that,
Yes.
that note that he holds during the chorus sounds a bit like that.
Yes, I can't get up there myself.
Yeah, neither can I don't think. It'll tell you that it's charging, and then it'll tell you that it's ready to shock, and then it'll tell you to stand clear. So
Right.
when it tells you when it's ready to shock, you need to make sure that nobody else is touching the patient.
Oh, okay, right.
And then you see this big flashing orange button here with a lightning symbol on it.
Oh, yes.
Push that.
Shall I press it now?
Yeah, press it now.
Here we go then.
Lovely.
Right.
And there we
Okay.
go. That's the shock delivered. And that
delivered.
means that hopefully patient's heart will have stopped and will have restarted on its own. But it's important that as soon as you finish doing that, you carry on with your chest compressions.
Right, okay, so you carry on. The heart started, and I'm carrying on with the chest compressions. Right,
Brilliant.
now, the question is, the heart might be pumping, but they may not be breathing yet.
Yep, so what we need to do is, you don't have to do this, but if you're comfortable doing it, you could do something called rescue breaths.
Rescue breaths.
Yes. So for every 30 times you push down on their chest during compressions,
Yes.
what you can do is you can then stop that for a second. If you tilt their head back like we did earlier with the
Okay, right.
with the breathing
Yes,
check,
yeah.
pinch their nose and form a good seal all around their mouth.
Right.
Then you look down the chest and you give a big deep breath into their lungs.
Another one?
Yep. So you do 2 in total. That's it. Perfect.
Oh, that's made me head spin.
And then you get straight back on with your compressions again.
Okay, staying alive. Staying
Always
alive.
key to carry on those compressions.
oh.
And then you just carry on doing those things until the ambulance arrives. The only time that you'd stop is if an ambulance or some other medical professional either tells you to stop,
Such as a doctor.
such as the doctor indeed. If the doctor tells you to stop, then you can stop. Otherwise, the only other time you'd stop is if the patient actually starts to wake up and fight you off.
Right, and slaps me across the face.
Pretty much.
generally people might think of a situation where they've come across someone collapse where they panic and don't know what to do. So I think us teaching them really helps settle that and give them a bit more confidence. Actually, I would know what to do if I found that situation.
Children and babies get a little bit more difficult because the ways that we do CPR change quite a lot depending on how old they are and how big they are. But if you ever do find yourself in the unfortunate position of doing CPR on a baby or a child, the ambulance service on 999 can talk you through it really well.
Right. That's very good, that, Harry. So how do you think I did there?
I think you did very well.
So do you think I could be part of the Gilthwaite first responders?
I'm sure you could, yeah.